Okay, I'm Corinne.
I'm Ethan.
I'm George.
I'm Dama.
I'm Taylor.
And Xavier, you haven't whatever.
Already said my name.
Oh, you did? Okay. Our article is the musculoskeletal education in undergraduate medical curriculum ACE systematic review. And overall, our article is about the different type of studies of rheumatic and muscular health and diseases, and how it is essential for human function, and what are some consequences that could be encountered from the hospital and community care settings with the rheumatic and musculoskeletal conditions. So, someone want to start us off?
Well, I just had like a big main question that I kind of just wanted to ask y'all. So like in the article, it says the primary objective of their study was to systematically evaluate the quality of musculoskeletal science education for undergraduate medical students. And kind of just like with that, I was just wondering, like in present day society, do you believe like we're being taught a lot about musculoskeletal science education? Like, because that's what the whole experiment's about, is just like their influence and through undergraduates. So do you guys think we're being taught a lot about that right now?
No.
Here to elaborate.
So we're just talking about muscular skeletal structures in general. I'm pretty sure unless you're a PT or somewhere in the nursing, you don't learn anything much about your muscles or how the skeletal system works in general, especially when it comes to disorders, patients' cares, and deficiencies. Is really a lack of knowledge in that situation. I mean, you can apply this to almost anything else that's concerning health. So, unless again your college major is about health, I think it's very rare for you to touch anything along this topic.
Do you think it would be important to have some background knowledge about it or no?
I think so. Again, I'm not saying everyone is always born with something, a disease or something like this, but I think people should know that hey, it's you can get something that involves muscle failure, breakdown of tissues. You could have bone deficiencies. A lot of people have bone deficiencies. So yeah, I think it is beneficial. Is it do or die? No, but I think it would help a lot of people.
Yeah.
I feel like I want to add on to that a little bit because I feel like we do get taught it, but I feel like in class everything's like really high pace. Like we're getting things done in such a short period of time. So we don't actually learn as much. It's more like we learn it, take the test, and then we kind of throw it out for the next one. So I feel like we do learn a lot, but it needs to be slowed down and more into detail, and then I think it'll be better.
Yeah. Adding on to that, I think they do a good job in undergraduate about like teaching us like the bare minimum, like the basics that you need to know to progress. But um like the whole evaluation of this article was about like knowledge, can't remember what they were calling it, knowledge like retention and being able to carry that throughout your confidence and clinical skills. I think those are all things that are not taught to us like until you get to your like doctoral program or whatever. And I think it would be a lot more important if it was taught to us in undergraduate as well. That way it's something to build off of and not just the most basic understanding and knowledge.
Yeah, and like school, they teach us the conceptual part, but where we actually learn is when we do it with our like where we do it with our hands. Just like how in medical school they give us like or they're gonna give us like a lot of stuff to learn in like one day. But the next day you don't know what you're doing, then what's the point of learning from those few slides they gave us all of you? You always gotta go to like clinicals, use what you learn, and that's where you actually keep it in your mind. In which they're trying to say in the article. With that, you can always with like exams and how you said that I don't know, I forgot who said it, but you said that you move on to the next exam and then you throw what was on the last exam away. That's very common with like our generation of students is because we only like learn like for the last week or the last few days on how the exam is, because we always try to cram it last second, but that's not how you actually learn. You got to keep on looking back at it and then using it in the real world.
So some of like the results that we were given in the article were like the key findings or whatever, but it was the methods in which undergrads are kind of being taught what they learned. So there's peer assisted and near peer learning, which is like working in groups. There was musculoskeletal anatomy instruction, which is like ultrasounds and um arthroscopy. I'm not sure what that was. It didn't really go that much in depth, but also technology assisted learning, um, intensive short like courses, and then different things like that. And they kind of all had either really great reviews or mixed reviews. But with those being like our key findings or whatever, what do y'all think could be improved? Like, how do you think trying to think of a good way to word it, but how do you think those results could be mixed or improved to see better outcomes in undergraduate like knowledge and retention and confidence and all of that?
Well, if we're going kind of more towards like the outcomes and how those can be improved, it said in the research that like they need to conduct more high quality studies to identify effective methods. And it said that some of the limitations during the study was like the small sample size, the poor response rate, and an absence of validated tools. So I think getting a bigger sample size and getting people who actually want to like pour into the study would definitely help find some of the limitations in that.
Yeah. Yeah, I think that's very, very true. I think something that I noticed was that of like all of the results, the one that had the most outcome and most like knowledge retention, clinical skills and confidence or whatever was the intensive short courses, which I thought was interesting that the 1 to 2 week classes were in like improving these students' scores and confidence or whatever more than, technology, group learning, like all of these other things. So I guess from that, how do you think we could like, I don't know, um, why do you think that is, I guess, is what I'm trying to ask.
I feel like a lot of education gets a lot more like prolonged than it should be. I feel like if it's like a lot shorter, like even the article it was saying like one of their like curriculum evaluations, it was like the Kirkpatrick model. Like there's like 4 steps, like different reactions, like different levels and things like that. I feel like just like the other method that they did is just more short and concise, gets like the point done. We understand what we're learning. It's in a short time span, and then we could just move on. Like versus a very long period of like trying to get to different stage, like trying to get like it just takes way longer than it needs to be because like it could just stick in our memory and then we can make it in our long-term memory within like the first 2 weeks. So I don't think it's that necessary to have like a prolonged education.
I think being in a group really helps. I feel like when I'm like with peers and I'm getting a lot of different minds on one thing and they can explain it in different ways that make more sense to me, I feel like that helps me learn more. So I feel like the group aspect definitely makes sense with me.
Well, does anyone have any more questions or things they want to talk about or things that they thought were interesting?
One thing that stuck out to me was the economic benefits They were just talking about how there was a big socioeconomic burden on a lot of people who experience these diseases. And I think like enhancing the education would help that. And that just stood out to me.
Do you think like long term till like even now they should emphasize that type of education more? Or do you
Yeah, I think so. They just went into a little bit of like the economic portion of it and how a lot of people aren't expecting getting diseases like that, and a lot of people do. And I think just getting more education on it would help the people with costs when they go to the hospital and stuff.
Yeah, by improving the education at the undergrad level, we can produce like more doctors who diagnose earlier, manage conditions better, and prevent like complications. That means like fewer hospital visits, lower treatment costs, and more people staying active and working. And investing in like medical education now could ease the long-term financial strain on like healthcare system.
Yeah, I agree with what Damo said. I think a big change needs to happen for undergraduate, especially ones that are entering the medical field, is I feel like for a lot of these medical classes, it's treated more as like you get the grade, you pass, you can move on. So a lot of these students that take it, that's all they're worried about. Because like these classes, especially like Bio 1, Chem 1, they're notoriously known to be weed out classes like that are hard to like kind of get out the kids that aren't suited for this. And I feel like that's what's causing a lot of these undergraduates to be unprepared for the next level. I think the entire system, especially for the medical side, is that you have to really let the kids understand and learn how these things work so they can be better prepared for medical school instead of just let them be worried about these making these exams hard, getting the kids that aren't ready to weed out. And I think that's like the main issue with all the undergrad graduate is that professors focus on exams being majority of the grade and tests being basically pass or fail instead of really trying to help these kids understand and learn the material.
Yeah, I think like being on the pre-PT track and understanding that like the majority of reasons why people will come to you like and seek your professional help is because of the like joint or muscle pain or whatever, and knowing that that's like something that is so like that we're not taught enough about kind of blows my mind, because it's like if that's like the main thing that we're treating, why is it that we're being taught inadequate information and like not getting enough in our undergraduate years? Because I think those are like, doctoral programs and whatever, very important about teaching you like absolutely the necessities. But I think your underlying education needs to be brought up a lot. So I think I don't know, that was something that was very shocking to me, I guess, reading about.
I think that's also because a lot of how you want to put it, a lot of specialties. So like if you're a doctor, you focus on a specific, I guess you want to call it procedures. So like you might be orthopedic or so on and so forth. You might be cardiovascular. So you might focus on the heart. Even though like everyone goes through the same processes of becoming a doctor, getting a doctorate, which is again studying one or two different three topics. I guess the muscular skeletal system is such a basic topic to discuss that a lot of people would just brush over it. Because again, like your PT, I want to be PT. If my PT is more about rehabilitation of like the lower limbs, like the legs, the calves, like helping people walk. And again, my focus might be on like, oh, your femur, your knees, your foot. And if yours is, for example, like people with scoliosis, like your back, your spine, some topics might get brushed over a lot, like maybe the cranial, maybe the phalanges, the arms, the legs, the chest cavities. So again, I think it's just like the matter of how important the medical field thinks it is, rather than hey, like we should know this. Because again, some people's specialties don't require them to know every little thing about the muscle or skeletal system. So I just think that the medical field has done a weirdly weird job of saying like, hey, like this is a basic thing you need to know about. We're going to teach you the bare minimum, like Damo said, either really quickly, really fast, and then we're just going to like let it be. And if you have to come back to it, you have to come back to it on your own time.
Yeah, I feel like they should implement more of like the clinical part instead of like labs. Cause I go into like I can use my OChem lab as an example. I do it because I have to do it, and I low key just want to get that shit out the way. I mean, get it out the way. And when I say that lab is very annoying, and I rather like if I compare it to like the anatomy lab, I'm not no shade to anatomy lab. It's not really a lab for real because we go in there 20 minutes. He teaches us, he doesn't even teach it. He just reads off the slides and then boom, we're off to learning by ourselves. That's the same thing as how medical, I know like I have a alumni in my friend group that he's in medical school and he said that's basically what they do over there. That's not how you're supposed to teach. If you implement more of like a clinical where we all sit down or you get a class, put them in like a room full of fake props of like people or real people, and we're really hands-on all that using with technology or peer learning and case-based teaching. I feel like the education can improve in that.
Yeah, I'm gonna
Yeah.
that one. Oh,
Oh, yeah. Damo said I 100% agree with. Like, I took BU trees and BU heroes, and those two labs I think were the biggest waste of times I've ever had. I felt like my learning didn't improve at all. I wasn't getting a better understanding of any of the court, like anything that I was learning about, and like, and instead of like getting proper help and really trying to further my education, they only just they only cared about getting the grades, doing these presentations, and these exams. And I think, like what Donald said about the professors, you're getting paid to teach the future generation of the next doctors, next PTs. And if all you're doing is reading off a PowerPoint slide and expecting them to learn, on my eyes, like how would you, of those professors, like how would you feel if that was you in those shoes? Like you're trying to take the next step and become better, but you have these type of people just not helping you at all. Like if they're supposed to be experts in their fields, I think we should be able to have classes where we go to like do practice clinical studies, being more of those like hands-on environments instead of being in a classroom, looking at a PowerPoint, taking notes, and then expecting us all to learn everything by the exam date.
okay. So, question: do you think that's more like a result of the academic system we're in now, or do you think this has always been a staple in education? Because, like, when we were younger, right? How many times have you guys gotten the quiz or like the multiplication table? Like, the one that has like 100 questions. Didn't everyone get that like almost every other week? It was
Yeah.
repetition for us. I think it's. Do you think like that's always been a staple? Like, hey, like stuff that's like basics that we're gonna need, like math, when we're younger, is super implicated because they think that hey, we're gonna use this over the course of our whole lives. We're gonna keep repeating this, or do you think that it's just like a what am I trying to say? I think it's just like a oh my days. I don't know. It's just something they just kind of put off because again, they have a lot of things that continue to teach. Again, multiplication tables have always been there, but then when it comes to subjects like this, again, like you said, they rush through it. Even if we're at college level courses, they just again give us a PowerPoint slide and expect us to self-taught.
I feel like they teach in a way where they teach to prioritize how the institution look as a whole instead of the individual. So they can teach they'll teach enough to get how the average enough of grade score to improve their class or the rating. But as soon as an individual comes to ask question, they're gonna be like, "Oh, I don't know. Oh, go use Google. Oh, do all of that." It's like they're leaving us in the dark without realizing, which I think that's how school or institutions been working since a long time. And I don't know if it's gonna change even with these new laws coming out, this new education thing. But are we doomed? Who knows?
I actually wanted to circle back a second. I wanted to ask you, Damo, again. Did you say it was your human anatomy lab that you weren't really learning like that much? It
Yeah.
was. Yeah. I mean, I kind of it kind of has to do with professors as well, because I have to like, I agree with your main overall point, but with my anatomy professor, it's like completely different. Like everything we're doing is actually like hands-on activities and like we're actually learning about different things. And I agree with your main point, like it's a total game changer. Like, because you're actually like feeling like you know where things are, like you're being shown it, like you know like the in detail for it. And I feel like what it shouldn't just be based off of like luck or like rate my professor, like which professor is like gonna be the best one. Like they should all equally be the same and like teach the same content and then like promote the same like principle so we all pass the class having the same amount of like knowledge, you know what I mean? Because like it's not, I don't think it's fair that like my professor gives us hands-on activities and like your professor just like reads through a slide without showing anything. You know what I mean? Like it's very unfair, and I feel like it's even on a broader scale, it's very unfair to a lot of different people, and it should be changed immediately. But yeah.
I think that's a great segue, like kind of tying it back to like literally just like the sum of our whole entire article is that the curriculum is what everybody should stick to, and that there's a big difference between lecture and lab. And lecture is, I think, like we've kind of all talked about, like it kind of gets not ran through, like quickly gone through or whatever, and then kind of forgotten as you go. And lab is supposed to be the hands-on experience that helps you tie that knowledge to the like the skills and stuff that you learn. And I think at least right now for me, my lab is very hands-on, which is nice, but at the same time, it's just reinstituting like the knowledge that we're being taught in lecture. So I think there's a good mix of like that does need to happen. Like lab should be the practical application of what you're learning in lecture, but there also needs to be some sort of involving like the clinical skills and stuff like that. So I think that goes into like this is the musculoskeletal curriculum as of currently, and whether it's changing what lecture looks like or what lab looks like there needs to be improvements made so that, you know, some students aren't getting like absolutely nothing, or some students are getting nothing and then while others are getting more. So I think curriculum needs to be updated and evaluated more strictly. That way the institution isn't just doing it based off of like what looks good, but it's how these students are performing after they leave the institution and all of that.
Yeah, I was gonna say like also just kind of summarizing or like what I've heard. I said like switching classes from teachers handing us information to take a test for a grade to actually like ingraining the information through hands-on activities and group work to apply to everyday life and work. That's what I feel like is kind of what we're all getting at a little bit.
Agreed. Yeah, everything. A lot of things used to be so hands-on and repetition. I don't know if someone said that repetition. We're just doing things over and over again. And now, again, I don't know if it's because we're in universities. I don't know if it's because of the university we have or certain teachers. A lot of things are like Damo said, George said, and Ethan just said. It's we'll give you a slide, we'll yap about it for a couple of seconds or an hour and a half, and then Godspeed, go study what they just said for like an hour and a half. So I think we're kind of all in agreement. It's just not the time or the present state we're in with the education system. It's more just this has always been here. Like Damo like quoted, it's always been here. It's just we're on the other side of it now. So.
And I think the main reason for why university is kind of like that is because we're all 18. They expect us to be adults and they expect us to kind of go through things like adults, Oh, if this guy's not teaching you well, you got to learn it by yourself. You got to be mature and be able to do it by yourself. When I feel like a lot of universities forget at the end of the day that we're still pretty young. Like we're just entering our 20s. We still have a lot to learn. We still need that hands-on focus to be able to really understand the curriculum. And for most of these colleges, all they care about is like the grades, the GPAs of the overall students, and just getting kids in and out as fast as they can. I mean, I know for like Baylor, I always see them like brag about like, oh, this class got a 3.7 GPA. And I bet if we ask some of those students in that class, they will tell you that they didn't learn anything in that entire semester. They just did go on the test because they cram studied for like the past 2 weeks.
Yeah. I think something like a big takeaway from this is that in order for the curriculum to change, students need to step up and speak about like what would actually be beneficial for us, because at the end of the day, like it's us who knows how we need to be taught, basically, and not up to the teachers who taught or who were taught like over 20 years ago, you know? So
I think also, I think some universities should have a higher like a better hiring process. It shouldn't be, oh, you did this, you have like you wrote these different books, you took these classes, you're qualified. I think they should really try to up the hiring process and really take it seriously to who can actually help these kids prepare for the next level, instead of just, oh, this guy can read off the PowerPoint slides well and has like a basic knowledge of it.
yeah. Does anyone have anything else to add or anything?
No, ma'am.
We're good.
Awesome.